When was the last time you went to the doctor and talked about your penis or talked about your sexual health in general? Chances are it has been a minute or possibly even never. In this episode, we are going to give you the doctor's visit you want to have but haven't booked on your calendar. Welcome back to The Naked Connection. This is the show that supports driven men to reach sexual mastery and build deep connections. It's Kirsten, and before we get any further, please take a moment and hit that subscribe button so that you don't miss a single episode. Today, I have Dr. Paul Gittins here. He is one of the leading sexual medicine physicians in the country, and he is going to answer the questions you don't want to ask. What can I do about my weak erections? How do I balance my testosterone levels? What should I do to improve my erection health? Maybe I come too fast and I don't know what to do, or I can't seem to ever come and I don't know what to do. We even talk about your prostate and what to look for if you're on weight loss drugs like Ozempic. This is a really science-packed medical insight into your sexual wellness. Welcome to the doctor's office. We'll be with you shortly. And let's get some. Let's be real. Your skincare routine probably consists of splashing water on your face and calling it good. But if you want to show up as the confident, put-together man that you are, it is time to level up. The Skin Ultra Advanced Kit from Manscaped will give you everything you need in one simple system. We're talking 4 products that actually work. An electric face buffer pro that deep cleans your in in only 60 seconds. An exfoliating face wash with brightening vitamin C serum that handles that post-shave irritation. And a lightweight moisturizer that won't leave you looking like a grease ball. Look, you guys, over 12 million men trust Manscaped, and there is a reason for that. This isn't some complicated skincare with a million steps that your girl is invested in every single morning and night. This is a straightforward routine that only takes a minute, and it will make a real difference in how you look and feel. So get 15% off the Skin Ultra Advanced Kit with code NAKED15 at manscaped.com. That's 15% off your entire purchase with code NAKED15 at manscaped.com. Your confidence will thank you. Dr. Paul Gittins, welcome to The Naked Connection. Happy to have you here today for this special episode.
Thanks for having me. It's really a pleasure to be on the show, and I hope a lot of your listeners will get some tidbits out of it they can use in their everyday life.
Yeah. In thinking about that, what can they get out of it when understanding you are really one of the leading sexual medicine physicians in this country, and you see patients every day who have most likely postponed some kind of concern and haven't addressed it until it's become more serious. And I'm wondering what has been one of the most prominent issues, especially in this space of sexual health, that you've seen men avoid discussing, but should really bring up sooner rather than later with their doctor. And maybe perhaps even from your perspective, what prevents them from having that conversation or making that appointment?
Yeah, when a guy is having any kind of sexual problems, when their penis isn't acting the way it should, or if they feel like their libido isn't as high as they should, or if they're concerned about their penis size, they feel very vulnerable. And in our society, guys just aren't meant to be vulnerable, especially when it comes to our sexual function. I think it needs to change, but it's just the reality of things. Men, when they come in, some guys have waited 2 years. Some guys have waited 5 years. I had a guy today that had ED for 13 years. And he finally said, listen, I've tried all these things and nothing's working. I want to know what's going on with me. I want to know why I'm having these problems. It does take a lot for a guy to recognize that they're having problems and then to take it a step further to search for help. Mm-hmm. We see a gambit of issues in our practice, but globally, these problems are really the same. And I think guys need to understand that it's not just happening to them. Like globally, no matter where you are, these problems that are happening to guys are happening to all guys. And for the most part, there's some really common sexual problems that men have. The most common thing is premature ejaculation. That's really common. That affects 30% of guys. There's erectile difficulties, and I like to say erectile difficulties. I try to not to say erectile dysfunction because it's not really dysfunction. I mean, a lot of guys are having difficult time having intercourse, maybe with the initiation or the maintenance of their erections. And it's a broad spectrum of things that could be going on, as well as there's a broad spectrum of issues you can have with your penis, right? You may be able to start and not finish. You may be able to go through things like have intercourse, penetrate, then it goes down, then it might stutter. There's so many things that can happen to the penis. Outside of premature ejaculation and erectile dysfunction, there's guys that have low libido and they may have low testosterone or may have other things. Everybody thinks that low testosterone is always the cause for low libido or that it's only cause of erectile dysfunction, but there's so many other reasons why guys can have these issues. So there's a host of things. I see a number of men that may have pain with intercourse or issues with delayed ejaculation where they're taking too long to ejaculate. You know, it's like 20, 30, 40 minutes and they're like, oh my God, I'm getting so tired here. And then their partner's frustrated. They're frustrated. So there's a number of things that we see in my world. But one of the most common threads is that guys don't like to come in when they have a problem in general. They just don't. And sometimes they need to be pushed by maybe a podcast like yours where you're giving them all this great information. Sometimes it's their partner that's saying, hey, listen, like you got an issue. We got to get this solved, you know? Sometimes it's when they're coming in, it's because they just broke up with someone. And that breakup was because they didn't address their sexual problem. So it really depends on the person. It depends on the relationship. It depends on what's going on in their life. Sometimes they push it aside. Like, for instance, today we had a guy that he's had ED and he's had premature ejaculation for a long time, but he's had kids and then he was going through a divorce and it was just no time to address it. So for him, it took a little longer than I think it would have taken me if I was having those issues.
There's a handful of different possible dilemmas that a man might face at some point in their life. And I appreciate that you share how really common some of these things can be. But I'm wondering if we can start to break a couple of them down. If someone is struggling with ED, perhaps maybe, I think oftentimes a question that comes up is, at what point do I know that this is a problem? Like maybe starting there and then walking us through a couple of steps to take or considerations to look at if this is something that a man is experiencing.
Yeah, I think a guy knows when his penis isn't functioning correctly. Yeah, and a guy he knows that there's a certain period of time where he's able to get that erection with arousal, right? There's a certain rigidity that he might have when he's starting to have intercourse. There's a certain rigidity that he knows that he should be maintaining while he's continuing to have intercourse, right? For the most part, I think most men know if they're being honest with themselves, but sometimes it's the partner saying, hey, listen, before you might have been like an 8 out of 10 or a 9 out of 10, and recently you've been having to stuff it in. What's going on? Is there an issue? And sadly, if it's a female partner, oftentimes they think it's their fault, which isn't correct, which kind of catapults the issue even further because now the guy feels guilty that he knows it's his fault, but now his partner is feeling bad about it. We know that ED for some men, not all men, but sometimes it's the first thing that we see for other medical problems that they may have in the future. It's important to get on top of it early. And for guys, I think that at least they should start talking to their primary care doctor and say, hey, listen, my penis isn't working. I used to be a rock star and it's not acting like it used to be.
Could you share what that might be a precursor of?
Yeah, of cardiovascular disease, heart disease. That's a possibility. That's usually the more common things, any kind of vascular issues. Could be an issue with testosterone or hormones. It could be a neurological issue. It could be a result of trauma that they might have had. It might be a Peyronie's disease, which is curvature of the penis. Sometimes guys get into more of adrenaline-mediated erectile dysfunction, and that's where, because they've had issues in the past, they just get built up, and the adrenaline builds up, and they get into this sympathetic kind of system, and it's just really hard for them to break out of it. So there's a number of things that we look for to figure out, like, what is your problem, in particular. So we really dive deep into that. And we have a good time doing it. Part of my job is really trying to get guys to feel comfortable and feel like they can really talk about their issues and how it's affecting their lives. I've had a bunch of guys cry about the issues. I have a bunch of guys that kind of respond a little differently when it comes to this, but nobody's happy about it. As a guy, it's like, you're not happy when one of your best friends in life doesn't work.
Okay. Yeah. So this could be a precursor for some more, equally serious and different medical conditions. I think that a lot of times the solution could perhaps be pills. Are medications like that kind of like a first start, or like
sometimes guys, that will be the first step. Either they go to their local like pharmacy or to get something over the counter, or they go to the gas station and they get like this superhuman male penis pill or something like that. You know,
do those actually work?
You know, most of them actually have Cialis and Viagra in them. So they do work, but it's just the doses are very sporadic. So you don't really know what you're getting. And if you are taking other medications, you got to be really careful because you can have an interaction. So you got to really be careful. Not everything over the counter is safe. Everybody wants to be on something that's natural, right? So they'll go to the gas station or they'll go to the over the counter somewhere else and they'll think it's natural, but it's really just Cialis or Viagra. So you just go to your pharmacy or something like, or talk to your physician if that's the route you're going to go and get something that is probably a little more potent and that's going to be a little more consistent than the stuff that you get from the grocery store or from the gas station. But for me, it just depends on what the guy is interested in. If he's interested in getting his own natural erections back, then we do some regenerative things, some restorative things that will help them get more blood flow to their penis if that's their issue, and they can have more natural erections. Or for some guys that want like a quick fix, then Cialis or Viagra might be an option for them. Yeah. So really, once again, it depends on the motivation of the guy, depends on their degree of ED, like how severe it is. If it's really mild, oftentimes you can get guys off their meds so they don't have to take it anymore or what have you. So it's a little complex than just taking a pill. But that is the first step for most people.
I'm wondering if someone is having, say, weak erections, are there any lifestyle modifications, or you mentioned wanting things to be natural, that a man could implement into his life today?
Yeah, I think that everybody should be thinking of eating healthier. The better your diet, the better your penis, really. You know, if you're eating like a solid diet, then your penis is going to be at its max. It may not solve the issue, but there is a progression when it comes to ED. Things do usually get worse, so it's going to slow down the progression a lot. And it may help with treatment in the long run. So being heart healthy is really being penis healthy. The best, if you can get blood flow to your heart, then your penis is going to be really, really happy about that. And it's going to function as well as it can.
Yeah, I love that. If your heart's healthy, your penis is happy. And yeah, because I've heard natural foods like beets help with erections. And I know there's like theories about pineapple influencing.
There are things that. Yeah, there are things that increase your nitric oxide levels, like beets do. There's other foods that you can eat that can help to do that. And so that might be something that you want to do like on a daily basis. Like you can have a beet salad or have some beets in your food. And it can help a little bit. It usually doesn't cure the issue, but it might help. If you have like really, really mild ED, then it might be able to give you a hard erection. So say you're maybe a 9, it might make you like a 9.5 or something. So those are things that are good. And once again, they're also good for the heart, right? Those are foods that you can eat that might help you. Exercise is great. Lifting weights is good. Getting that testosterone up with that naturally and increasing your growth hormone with lifting weights and everything. So those are really good. But living like a really healthy lifestyle if possible, like doing some resistance training, some cardio. Those are things that a lot of guys should do anyway. But if there's a motivation that your penis will get harder, why not? Everybody's going to do it.
Yeah. So that's ED. Can we look a little bit at PE, premature ejaculation or early ejaculation? And what can a man do if that is something that he's experiencing?
Yeah, so rapid ejaculation, as I mentioned, it's very common. I would say probably most guys sometime in their life probably had it. At some point. Maybe they were in the back of their car with their girlfriend in high school and they got too excited or something like that. Or their partner surprised them and they're like, oh, they're wearing a sexy outfit or something. Like rapid ejaculation usually happens. One of the definitions is it's ejaculating before 2 minutes, but we see a range. We see guys that used to ejaculate in 10 minutes and now they're at 5 or 4 and they're really feeling some distress about it. So distress is really important. If a guy says he's like doing it at 20 minutes and he wants to go to 40 minutes, I'm like, that's not really premature ejaculation. You're just being greedy. But yeah, that's the most common issue. For guys, it can happen from the first time they have intercourse until they're 45, 50, 60. It can be a lifelong, or it could be something that is occurred after having really good sex and in a fairly good time, and then they just happens to them. For those guys, we want to make sure that there's not any issues with hormones or thyroid or anything like that. We want to make sure they are getting a firm erection as well. Just because if you're having some ED, we do know that if you have an ED, then you may have associated premature ejaculation because of the ED, right? So that could be it. You could just be having it and still have hard erections. There's a number of different treatments for that. One of the first things guys try is probably like a spray, like a numbing spray that might be able to allow them to last a little bit longer. I always tell guys, if we're going to do that, then make sure you wipe it off. If you're having like oral sex or something like that, you don't want your partner to have a numb tongue. We don't want to do that.
Yeah.
So numbing sprays, they work pretty good for a lot of guys. And then there's a theory on serotonin, and increase in serotonin may help it, though sometimes it's like an antidepressant of some sort. For certain cases, you can use some other medications that work on dopamine receptors and opioid receptors. So some of those medications can help. Sometimes I do a lot of penile filler. So I make guys' penises bigger when they want it. So sometimes when we do that, they'll have a little decreased sensation in their penis, and they can be helped with that. And some other things we do with Botox and some other things that can be helped.
Okay. So there's a lot of potential medical solutions to work with improving duration.
Yeah, it's interesting. Where I said before that when a guy has ED like that, the rate of their partner feeling guilty about it and that it's their fault is pretty high, right? And then they feel like they're not attractive to them anymore. They might be cheating on them or something like that, But for premature ejaculation, it's always the opposite. It's always, not always, but oftentimes it's the partner saying you're just being selfish. You're just trying to have your orgasm and just have me hang out, So it's the opposite. It's interesting, but in both situations, it's not the patient's fault. It's really not. It's what's happening to them because something's not right with their body, not right with their penis or their ejaculatory system. And so sometimes we just needs a little alteration and for things to, a little kind of jumpstart to get going.
Mm-hmm. Okay, so that's PE. And on the other end of this spectrum would be delayed ejaculation. And what often causes that, and what could a man do if he is in that situation where he's going and going and going and not able to reach that ejaculation when he is desired?
It's funny. I never see a young guy that's got delayed ejaculation. It's always the older guys. Like the young guys are like, listen, doc, I'm trying to go as long as I can. I don't want to stop. I got to prove myself. And as you get older, 5 minutes is enough. I'm done. I just want to be finished. I'm joking. But yeah, delayed ejaculation is an issue. If you used to go at a certain time and then you're going much longer, then it could be a problem for you. In general, the definition is give or take around 20 minutes or so. That's one of the definitions of delayed ejaculation. But if you're a guy that used to go a minute and now you're going 9 minutes, 8 minutes, maybe it's too long for you. There's a lot of reasons for delayed ejaculation. Sometimes it's a sensation issue. Sometimes it's a hormonal dopamine issue. Sometimes it's a hormonal issue like your testosterone or your thyroid or something else going on. Sometimes it's a relationship issue. I have a guy that can ejaculate with his girlfriend, but when he's with his wife, he can't do anything. So what's going on there? And sensation for the penis is really strange. I always tell my patients, like, all right, what you think feels good, maybe not, right? Depends on sometimes an emotional connection or a connection with that person. Like, for instance, if you hold somebody's hand, right? So say you hold one of your parents' hands, right? And you guys are walking, it's your mom, it's your dad, it's just like nothing, right? But then you have a partner and you hold their hand, right? And you're like, I'm feeling warm inside, and so it's different. So sensation is so different, and sensation's different for the penis too. sometimes depending on the partner or sometimes depending on what they might do, it could affect the ejaculation. And so we do nerve testing, but I tell guys, even if your nerve testing is normal, sometimes it's the person you're with. Sometimes guys who have delayed ejaculation, we have a couple guys that have a unorthodox masturbation habit. Sometimes guys, they'll rub their penis while they're like lying flat on the bed. They're face down on the bed and they rub their penis. We see a number of those guys after some time may have some issues with delayed ejaculation, occasionally premature ejaculation, but mostly delayed ejaculation just because of the way they responded to masturbation at such a young age, and they're just not getting that friction or that sensation when they're with a partner. We're really complex as humans, and there's so many things that affect us sexually and emotionally, and some of those things are hormonal, some of those relationship issues, some of them are like what else is going on in our life, and maybe bad habits we picked up over time. Or it could be just like a medical issue that's causing it. Like if you get hypertension and you got high cholesterol and you smoke and your penis doesn't work, and that's probably the reason why.
Yeah, I appreciate that you mentioned some of the masturbation habits or practices, that how that could influence the way that intercourse or sex with another person ends up being if your body is so used to doing things a certain way. I know sometimes there's components where maybe someone is going really hard, really fast, really firm. And so when they step into a sexual exchange with someone, that same level of sensation isn't there anymore. So looking at how can you adjust your masturbation in a different way so that you actually increase your sensitivity in time.
I think communication with partners are really important. And really, depending on that partner, is saying what you like and saying what you don't like. I always tell my patients, especially going into relationships, whatever your idiosyncrasies are, like you like somebody to tickle your big toe, I always say you got to say that early. You got to put it out there, because it's really hard to do it when you've been married for 5 years and you say, tell your partner, like, tickle your toe. And she's like, what are you talking about? Who are you seeing? Like, why is this new? And it makes them feel uncomfortable. So I always have my guys, I just tell them, like, listen, put your wish list out there. It doesn't have to be the first date, but when you're intimate, be like, this is what I like. And what do you like? And then you can see if you're sexually compatible or not. There's some people who are like, something's really important to you. I have a guy in my office and he's like, I have to be able to put my finger in the anus of a woman. Like, I don't know what it is. I have to be able to do that. That is like my thing. Right. And so he was with this girl and she was like, no, this is an out. Like, it's the only thing's going out. And he had to break off after some time because he just couldn't, that was his thing. One of the most interesting patients I had was, this is a guy that's 90 years old. He was coming in for some erectile issues. And his first sexual experience was looking at magazines, right? And he was looking, this is back in the day. There's no internet. This is just magazines. And in those days, he was saying that they were somewhat covered, but the ones that really turned him on was the ones with a woman smoking a cigarette. They had to have a cigarette. And from the time where he was reading those magazines till like the time he's 90 now, he can't have sex without somebody smoking a cigarette or the smell of cigarettes. So that was his thing. Yeah, I don't know if it's healthy. His lungs are probably pretty bad, but you got to know your thing and you have to be honest and you got to be able to talk to your partner about it. Or you're just not going to, or you're going to be going somewhere else. Maybe you're just not going to be happy with the relationship.
Yeah, I really love that you're sharing that. I think that especially for anyone that's out in the dating space, I think so often people are looking for compatibility and life values and interests and hobbies, or do our lives collide? And one of the things that I think is equally important is figuring out, are we sexually compatible as well, not just compatible in the relationship and the interactions and what we like to do, but what do we like to do in the bedroom? And is that something that we're interested in exploring together?
Or will you work with me? Let's say you work with me or not. Or it's one thing. It's okay to have different experiences, but it's another thing to be somewhat, obviously everybody's got their no. Whatever that no is, you got to be true to that no. But maybe we can work with something that might be close. And those are things that I think, it's obviously all the things that you mentioned before. Are you compatible? Do you have like life goals that are similar or whatever it might be? But I think this is also important. And I think that it should be talked about, not the first conversation. I mean, you may look like somebody that's strange, but at some point early on, I think it's definitely something you should talk about.
Yeah, and I remember I had a guest on a while back specifically looking at erectile dysfunction. And one of the things that he mentioned was how often many of his patients, one of the reasons why they were having this ED struggle was because they had a fantasy or a desire or a style of sex that they felt shame around asking for or bringing to the table. And so because of that, that was one of the impetuses to the problem that they were facing in their performance.
I think that definitely can happen. But when you look at ED, I think, and we're talking like about these like red herrings, but the most common reasons for ED is it's usually because of like other medical conditions. It's usually because of the fact that the guy's got high blood pressure or because of smoking. Like smoking is horrible for your penis, like horrible. But these are the things that are so common. Guys that have issues with their hormones or any of these medical diabetes, it's huge. You get diabetes, most likely you're going to have ED.
Those were two things that I wanted to ask you some questions about. One was first hormones in general and looking at testosterone, because it seems like there's testosterone replacement therapy centers all over the place now. It's so common. And I'm wondering, is there like a gauge for what actually constitutes low testosterone versus normal, age-related changes? And I guess how can men distinguish between medical need and this cultural messaging that perhaps is out there right now about
What do you
going
mean?
to get that testosterone?
Testosterone will cure the world and cure all your problems. Of course it will. No, but yeah, so there's a lot of these testosterone centers that are out there. And I think that a guy has to understand that usually when a guy has ED, they think it's first of all, their testosterone. That's what they usually think. But when you really look at, what's out there, I would say probably like 18%, maybe 20 at most percent of guys, their ED is due to their testosterone. So that's like the majority of guys, it's because of something else. But when you hear this stuff on the radio, oh, it's going to give you virility and it's going to make you like, be able to climb Mount Everest and all this stuff. That a lot of that it's not true, right? And I think it can be helpful. It can be helpful if your testosterone is low. It can be helpful if you're symptomatic from your testosterone. But those are the things that you have to kind of figure out. In terms of guidelines, so the guidelines, which I don't agree with all the guidelines, to be honest with you, but the guidelines are if your testosterone's less than 300 and you have to have two morning testosterone levels, and you should be symptomatic. I don't agree with the number so much, but I do agree with that you should be symptomatic. Like you should have some problems.
Can you describe what some of those symptoms might?
Some of the symptoms are like fatigue, decreased well-being. It could be low libido. It could be erectile difficulties. If it's really, really low, you can have some problems with fertility. It could be some depression as well. Maybe you're not making as much muscle mass in the gym that you used to. Those are the most common things, low testosterone. But there are also common things of like just depression, right? You could be depressed and, man, I don't feel good. I don't want to go to the gym. I want to have an erection. I just sort of sit there. It could be side effects of maybe you're not sleeping at night, right? You have COPD, or say you have sleep apnea and you're not sleeping at night and you're waking up. So then you're going to be fatigued during the day. You're going to be tired. You're not going to have the virility. You're not going to want to go to the gym. There's other things that can also give you those symptoms. So the key is to match up those symptoms with levels of testosterone. And I don't agree with the 300. So I'm with some people with that, but you want to be smart about it. When I use like numbers, I use them as gauges. That's it. I don't say this is what your number should be, because in the reality, everybody's different. And so I would tell people, like, if you're a physician, if his only goal is to get to a certain number of testosterone, then I think he's missing the boat. I think there's other things you should be looking at. You should be looking at, is it symptomatically making you better? For some guys, they come into my office and we said 300 was the number, and say they're 300 or 299. Let's say they're 299. And they feel great. They're like, oh man, mentally, like I got no brain fog. I just won like the chess championship. I look at my partner and I want to jump all over her. I just ran a marathon. My penis is going great. But my testosterone's 299, so it's low. Like, should I get on testosterone? The answer is probably not. Because I'm going to give you testosterone and it's not going to make you feel any better because you already feel pretty good.
I know this is a question that has come up before in this conversation, is looking at if someone is taking testosterone replacement, what are the long-term influences? Let's say that they stop taking it. Does their testosterone deplete? Has the body forgotten how to produce it itself if they start to titrate off of this?
Yeah, so when you take testosterone, your testicles don't make testosterone anymore. They get small, they get what's called atrophy. And if you come off it abruptly, then you won't make your own testosterone. You're going to feel miserable. So there's ways to take people off it. Like we don't ever take anybody off it. We kind of start stimulating the brain and everything to start working again. But I think if you need testosterone, it doesn't matter if your testicles don't make enough anymore. If you need it, you need it, right? And if your body's not making it, then it's not making it. You got to supplement it. We don't have the ability for you to, there are medications that we use that will stimulate your own natural testosterone, and they work a little different from testosterone. There's a whole group of things that we use. But if you're talking about testosterone and you're on it, then yeah, your body's not going to make it, and then you'll have to be on it forever. But that's okay, I think. If you're not making it, then you're not making it, right? You have to supplement it.
And I know back in the day, probably not that long ago, when like taking steroids was, it still is a thing, but thinking back about when people were taking steroids and having hair loss and changes in skin and acne and things like that, is that the same case with the testosterone replacement?
So testosterone is a steroid. So it is a steroid. It's just a steroid that's legal, but it's steroid. It's the same. The other anabolic steroids have different properties and they act a little differently in the bloodstream. And then when it gets into the brain and the penis and the muscle and everything, but they're all steroids. When you're administering testosterone, you can get some, I say acne is probably the most common on all of them. Hair loss, I find, is fairly rare if you know what you're doing. If your levels are going really high, then you may have some hair loss or some thinning, but I don't really see that, to be honest with me, or maybe all my guys are already bald. No, I'm joking. I know, I'm honestly. But I don't usually see that. If you keep your levels where the goal is really to find the sweet spot where, guys are feeling much better, right? But you're not going crazy with your testosterone.
Yeah.
Right? Because I know that no matter how much testosterone I give, after a certain point, it's not going to make a difference. Once your receptors are saturated, then you can give 10 times the amount. They're not going to feel any better. They're just going to have more side effects, right? And so you want to find the sweet spot for that patient. And that patient's sweet spot might be, 301, right? Because they may be saturated at 301. It might be 500. It might be 900, It's one of those things is when you do it, you got to make sure you're doing it correctly. And then I just think that when your doctor starts number hunting, then I think you got to find another doctor. Because they obviously don't understand the complexities of testosterone, how it works, the side effects that you see. I had a guy that went to one of these testosterone centers, and his testosterone was like greater than 2,500 or something like that. His estrogen was like through the roof. It was almost like 95 to 100. And I was like, we're in trouble. We talked about some things to do. His hemoglobin was really high, and he left my office. I didn't put up with anything. He ended up having a stroke,
Wow.
So this is not something that people should really think is like something that, if it's done incorrectly, then it could really hurt somebody. Obviously, that's an extreme example. There's a lot of extreme people that are out there. And I think people have to just be conscientious of who they're getting it from.
I appreciate that you mentioning this element of it isn't just about the number. And it makes me think about how the BMI used to be such a marker and an indicator of, are you in a healthy weight or not? And it didn't ever take into account muscle mass versus fat mass. And
of course.
People are thinking they're obese and they're jacked, just looking at the reality that a number isn't going to tell you exactly what's going on in your body. And they're really more used as you described, a gauge, which I think is helpful, especially if someone listening is going to one of these clinics and or going to a doctor who's just looking at the number. That's really helpful to have that information. And you mentioned this piece a while back about someone having diabetes and the influence that can have on sexual health. And I there's like the rise in this Ozempic medication usage. And I'm wondering, how do these GLP-1 agonist medications influence a man's testosterone levels? And just, is there anything from your experience that you think should be taken into consideration if someone is on one of these specific medications?
Yeah, Ozempic makes your penis look bigger, which is a good thing, right? I mean,
Really?
it makes you weight, right? It makes you lose weight. You lose some of the peripubic fat, which is surrounding your penis, and you lose in weight, and guys feel better with it. But seriously, there's been one paper about Ozempic. It's a urological paper that came out maybe 6 months ago. And it showed that with Ozempic, there's about a 1%, and it's really low. 1% or 1.4 or 1% of patients may have some erectile dysfunction or other sexual problems, right? So it's 1.4%. So it's really low when you're looking at sexual problems. So we don't think that that's a cause. At least that's just one paper, but we'll see. And Ozempic has a number of positive effects, I think. So there's already been shown to show some cardiovascular benefits and all these other things. For a guy, it's like, all right, now like I lost all this weight. I feel sexy, right? Guys can feel sexy too. I got a little more confidence, right? But the one thing about Ozempic, which you have to pay attention to, is there's some people that do have some muscle wasting. And I find the people that have a little more muscle wasting with Ozempic, they talk about the Ozempic face and all that other stuff. Then you got to really watch their hormones. Sometimes their testosterone may dip because they lost the muscle, because muscle is going to, like, when you're building muscle, it can increase your testosterone a little bit. So I think those are the patients that I really, really look out for that are on Ozempic, which has the muscle wasting. But losing weight is great. And then what we know about Ozempic, I'm definitely not someone that's negative towards Ozempic. I mean, everything that I've seen is actually more positive than negative. I think it makes your penis bigger. I think it gives you, but it does.
Does it actually make your penis
No,
larger?
it's the appearance. It's the appearance. It's the appearance. I'm joking.
Hey.
I mean, I'm sorry. It's one of my like sexual medicine stuff. Like when guys come to my office, we just laugh a lot. But yeah, the appearance of it makes them feel sexy. You know, women aren't the only creatures on this world that get to feel sexy. Guys want to feel wanted, right? Guys want to feel like when they put on a shirt that it fits them properly. When they go on the beach, they want to, somebody's looking at them. They're like, all right, I got a little more self-confidence. So all the women out there, when you see your guys, you know, naked or something like that, tell them how good they look, right? It's really important for men.
Yeah. Okay, thanks for touching on that. And the last piece that I want to look at today with you is, I know we've talked a lot about penises and erections, and an element that I think is probably equally important is prostate health and screening. And I know that, you know, screening recommendations have changed over the years, but I'm wondering if you could walk us through the kind of the pros and cons of different screening approaches and like how men could approach this decision with their doctors.
So prostate cancer screening, now it's about having a conversation with the patient. You know, we're screening a little bit later for men that have low risk factors. So if you've never had a family history, if you're white, but if you're African American, if you have a family history of prostate cancer, if your mom has a family history of breast cancer, then you're going to be screened a little bit earlier. For me, what earlier means for me is 40. I'm going to check a PSA. I'm going to do a rectal exam. For everyone else, it's a lot later. But I'm a guy that really likes more information. And so if I'm 50, even if I have low risk factors, I'm going to ask for a PSA just because I want to have that number early. And the earlier you have it, the more of a trend you can look at, right? So if you get your PSA when you're 65 and it's a little bit elevated, you're like, all right, what was it when it was 40 or 30? Is it similar to that number? Maybe it's just more of a component of like benign prostate hypertrophy, which is BPH. So I like to have that information for most guys around 50. But you have to have the conversation and you say, listen, you're checking your PSA, which is a blood test. We may do a rectal exam, which I always do, but some guys don't want it and I'm fine with it. It may end up you having an elevated PSA and we may have to do a biopsy, and the biopsy may show that you don't have prostate cancer, but you just had a biopsy for no reason. And there's risks to biopsies. So that's the thing. That's the conversation that you have to have. But if you're an information guy, which I am, but if I have no risk factors, I want my PSA at least at 50. If I'm a high risk guy, I'm African American, family history of prostate cancer. If I was somebody that had a family history of breast cancer, then I'm going to want to get that early. just to have that information. So that's the nuts and bolts, I think, of prostate cancer and PSA. And the recommendations, like I said, we were at the point several years ago where we weren't checking hardly anybody. Nobody was checking PSAs. And we found that when you're not checking PSAs, that we were seeing more and more deadly prostate cancer that we were figuring out and finding a little bit later. So then we went back to now checking PSAs. It's the most common male cancer outside of skin cancer. So it's something that most guys are going to get, but not most guys are going to die of. So you want to make sure that if you do have it, if it's like a low grade prostate cancer, then maybe you just watch it.
One of the things that I've really been picking up from what you've shared is recognizing that a number isn't black and white, and how really individual every person's body is. Even from the prostate cancer screening numbers to your testosterone levels to the duration that you can maintain an erection, all of these things are really going to be individualized. And so I think that just shows how important it is for everybody to be aware and understanding of their own body and not just looking at something and making a blanket statement. Is there anything else as we close out here today that you think is really important just for a man to have either in the back of his mind or for him to take action on or to implement into his life to really have great sexual health?
I think that it's the boring stuff. The boring stuff really allows you to live longer. It allows you to have your penis stay up longer. Have better erections, all these other things. It's the boring stuff that really pays the dividends, you know? And the reason I say this is because my last guy was a financial guy. And so if they invest just like a little bit every day, right? They close their eyes in 30 years and they're like, damn, I got a lot of money, you know? And it's the same thing. You invest every day in your penis and your heart. And then at the end of the day, like you look back and you're like, damn, I'm healthy when I compare myself to my friends that are 70 or 75 years old. I'm walking around where these guys are in wheelchairs and they're doing other things. So it's a boring investment that you're making every single day. Everybody wants a cheat code, but you got to do the boring stuff.
So taking the small, mundane but necessary actions every day to really invest in your sexual health and making sure. I loved how you shared that if a man has a problem with his penis, he knows. And so if you're listening, and just take that step forward and see the doctor. And it sounds like you have a lot of fun in your office and find a way to make the experience almost not so heavy. I appreciate you coming on the show and sharing all of this knowledge with us and opening the door for someone who might be in a place of recognizing and acknowledging, I do need to go see somebody to get some help on this. So thank you for being here.
Yeah, thanks so much for having me.
Thank you so much for tuning in to this episode of The Naked Connection. Be sure to subscribe so you don't miss another episode. Trust me on this, your sex life and that special someone in your life will thank you for it. And if you really love the show, please take a moment and leave a 5-star review or a written review and let me know what you think. It would mean so much to me and this show. Until next time, happy connecting.